Thank you very much. And on behalf of the Pfizer and BioNTech team of manufacturing engineers and development scientists, I want to thank you for the opportunity to share with you a little bit about what we've been doing. So what I'll do over the next 15 minutes or so is take you through a quick end-to-end view of the supply chain for the for our vaccine, and then given that this is an innovation conference focusing on technical breakthroughs, I'll go back to a couple of examples where we had some real challenges that required innovation to solve. So starting on the left here, first step is the plasmid DNA, and that is sequenced specifically to generate the antibodies that will work against the spike protein on the COVID virus. Now that plasmid DNA is produced really by standard cell culturing techniques. Basically, we have the master cell bank. We grow up some of the plasmid DNA, and then we linearize it to stabilize it and for use as a template. The second step is to actually produce the mRNA itself. That's produced via what's called an in vitro transcription reaction, which is basically an aqueous reaction around 30 degrees centigrade for 2 to 3 hours, where you add the nucleotides, which are the building blocks for the mRNA, along with transcription enzymes that bind it to the template in the right sequence, and then some other specialty components like capping agents and quenching agents to liberate it from the plasmid DNA. And then finally, we purify it by tangential flow filtration, and then we freeze it to -70 for storage. And that gives you a hint of the fact that the mRNA, the naked mRNA, is not very stable from a thermal standpoint. The next step is to prepare what are called lipid nanoparticles. The mRNA, if it was just introduced in your body, would be degraded very quickly by your body's systems. So in order to protect it from the within your body, as well as to deliver it to the targeted cell, so the mRNA can cross the cell barrier and generate the antibodies, we use a system of 4 lipids that surround the mRNA and protect it as it's injected and goes through its process in your body. Once we have those LNPs, we use really pretty standard aseptic fill finish technology to fill that into a vial. We then go through, again, a standard inspection where we verify that we have the right amount of liquid in each vial, make sure there's no foreign matter in there, and then we label and freeze those vials to -70. We then go through a package, storage, shipment sequence to get it to the end use. And those are really fairly simple and standard operations. But as you can imagine, there's plenty of challenges considering the volume of product that we had to move and the temperatures that we had to move it at. And I'll talk a little bit about some of the challenges there with that. And then finally, the last step, the vials arrive at the doctor's offices or clinics, and the healthcare providers prepare them and then inject them into patients to vaccinate them. So that's a very quick view of kind of the end-to-end supply chain. So focusing on some of the challenges and the innovations along the way, I think the first one is just, and I expect Ugur talked about this during his introduction, is just the concept of mRNA as a way to generate an immune response. Traditional vaccines typically rely on a component of the contagion to generate that immune response, either a virus that's been killed or an attenuated live virus or a fragment of that virus or a fragment of that virus placed into a capsid from another virus to deliver it, adenovirus technology. But all of them really rely on some part of some component of the contagion in order to generate the immune response. The RNA has nothing to do with the COVID virus other than the fact that it's sequenced to generate antibodies against it. And it's produced completely without any portion of the virus. So in that regard, it's a cleaner process, a cleaner platform for vaccination. It's faster to produce. As you can see on the chart here, it's 60 days end to end. For other Pfizer vaccines, the lead time ranges anywhere from 6 months to 2 years. So a much faster process. As shown in the clinical and real world data, it's got excellent efficacy and really minimal side effects. So a credit to the BioNTech team that discovered and is working with this technology, and the Pfizer R&D scientists who helped them along the way. So that's really the first example of innovation. If you look at step 3 there, the LNP step, the scale up of that, I think, was a real technical challenge and a real credit to the team to have gotten through it. The lipids are mixed with the mRNA in what's called a T-mixer. It's basically a high shear mixer. And that creates the lipid nanoparticles, which are very fragile entities. One of our scientists described it as cotton candy, which I think is a very good description of it. Turns out, and we learned this the hard way, they are very sensitive to pressure, flow rate, residence time within the mixer, just about everything. So you really have to control that process very tightly to give the correct configuration, the correct particle size. And the particle size definitely is related to the immune response. So you need to stay within a fairly narrow range. The original process that we started with used a T-mixer. I'll hold one up that's about this size. And it was on a bench in a lab. It could produce maybe 1,000 doses a day. And it was controlled by a group of very experienced technicians who manually controlled all of the flow rates and all of the parameters. And I think the accomplishment was the fantastic engineering required to scale up and scale out and replicate that process so that you could go from maybe 1,000 doses a day to billions of doses a year. And that really required collaboration with the fabricators, the equipment manufacturers, the Pfizer and BioNTech colleagues, automation engineers from internal and external that came in to really help us out. So what we wound up doing actually is we didn't have enough time to scale this up. So we replicated it, we scaled it out. However, we scaled up everything around it. We automated it, an amazing piece of work. We basically did what would normally take 2 to 3 years. We did it in 4 months by doing everything in parallel and by just working night and day and weekends to work through this. So, and we were successful. We now have the LNP technology in about 8 locations around the world, and we call them LNP skids. We've got about 20 or 25 LNP skids running full time to produce the lipid nanoparticles. And then if you look at as I mentioned, the pack, store, and ship, that again is a fairly standard operation, even in a cold chain. If you're dealing with hundreds, thousands, or even hundreds of thousands of doses of a vaccine, when you start trying to look at billions of doses, it becomes much more of a logistical challenge. So the first part of that challenge is just storing the doses that we produce, storing them at minus 70 degrees, which is the temperature required to ensure stability, storing them for the period of time that it takes to test and release, and then holding them until the customers are ready to receive them. And you need what are called ultra low temperature or ULT freezers to store these. And nobody really has that many of them. So we had to work with the manufacturers to scale up their production. I think we bought the world's inventory of ULTs. And then we had to create freezer farms at our manufacturing and our distribution sites in order to store all these freezers and be able to access them to put the doses in and get them out and track all the doses throughout the whole process. So I think we have well more than 500 ULTs stacked up in half a dozen locations around the world that are doing this. So that was the first part. The second part really is there was no shipment system for high volume product at minus 70 degrees. So we had to work with a lot of the shipping companies to design and build out a shipment system. And you can see in number 8 there, the shipping system. That's what we call a soft box, which is actually a box in which you put a nest of the vaccine vials in the middle and what we call pizza boxes. You then surround it with dry ice to maintain the temperature. You then put in a controller, which is a GPS, so you always know where your box is, as well as a temperature recorder that will notify our central hub if ever the temperature goes out of spec. And we had to have thousands of those produced so that we could start to ship the product globally. So that was very successful at all as well. And then just on the DT side, organizing the logistics of shipping, hundreds of millions of doses a week in these small boxes to thousands of locations around the world, and tracking them was a huge data operation. And they did a great job with a virtual hub that we can literally look at any dose, where it is, what its status is around the world. So I think that's the story. Those are the examples of innovation that I wanted to mention. And we do have more stable formulations under development. So we've learned a tremendous amount from this experience, but we'll be able to give back some of those ULTs in hopefully the near future. So that pretty much concludes what I wanted to say, and thank you very much.
Kevin, thank you from us to the US, to New Jersey, to Pfizer. Kevin Nave, you give us, I think it's a stunning example of people working together. If we can do it with COVID, hopefully we can do it to combat other diseases as well. So please give our regards to the entire Pfizer team over there. Anna Maria I was working with, and of course our friend Glenn Riddell as well. And good luck in the time ahead. And I presume a man like you isn't going back to bed, but you've been up early, so thanks very much. Good luck. Enjoy the holiday weekend.
Thank you very much. Take care.
Take care.